I want to pick up with Nadine Dorries, who's the Minister of State for Mental Health. Nadine, very good to see you. Chris Whitty was actually making the point that Anushka was just making, that the toll on kids when it comes to their mental health of not being at school is huge. You must be pushing the Prime Minister, surely, to get kids back before the 8th of March.
Well, we know I want children to go back to school when it's safe for them to do so. But we do know that there are two groups whose mental health have been impacted during the pandemic. And they are people who had pre-existing mental health illness and children and young people, or actually young women aged 15 to 26, particularly those with eating disorders. So we have a lot of surveillance taking place within the NHS. I've been really proud and impressed with how the NHS have stepped up and the services they put in place, particularly to deal with those young women aged 15 to 26 and those with pre-existing mental health illness. But I'm also relieved to see that there has actually, over the period of the lockdown, first lockdown and into this summer, Professor Lewis Appleby at Manchester University undertook some real-time surveillance of suicide figures, and there has been no increase in suicide, zero increase, which was a huge relief. But what I'm not saying is that, you know, it's the picture for everybody isn't the same. Families particularly have reported that they've had positive experience in their mental health. The overall satisfaction rate of children, young people overall with their life has only just dipped. Some reporting good mental health effects. But, you know, we're going into a period of, it's a prolonged period now. We've been through the winter. We know that moving forward, what people have coped with hugely well so far, with economic uncertainty in the future and a longer term lockdown and children having been separated from friends and their social circles and their usual activities, that we are preparing for and aware that there may be problems further down the line, but we're well prepared for those. We've funded and established services ready to pick those children and young people up should those problems arise. I
mean, just when it comes to suicide, I mean, when I talk to the Office of National Statistics, they just say it takes a very long time to collate this data. It's obviously encouraging news that real-time surveys don't show a worrying increase, but I think most would say it is really too early to make a definitive assessment. But the one thing
that's not true, Robert, because real-time surveillance took place over 9 STPs and 9.5 million people. It wasn't just a random sample or a small study.
I'm not saying it's a random sample. I'm just saying when we talk to the ONS, they simply say to us, "You're going to have to wait for our data." And you know, it's not all, as you will be aware. You know, sometimes it takes quite a long time to classify deaths as suicides, as you know.
So we're introducing real-time surveillance as a standard method of reporting suicide.
Which is great.
Public Health England are working on that model. In fact, Professor Lewis Appleby's modelling and study has widened and taken in more areas and become more extensive. Real-time surveillance of suicide is going to be the way that we survey, monitor and record suicides in the future. The problem with the ONS data is that they do wait for coroner's reports. They publish their figures once a year, usually in February. That's too late for us. We need to know when we have problem areas, issues that we need to deal with and get on top of quickly. And so we want the real-time surveillance, which is what happened during the year.
No, which is, as you say, I'm sure, a great step forward. Can I just, though, go back to this issue of provision of mental health services? You will have seen the Children's Commissioner's report, which pointed out that there was a 35% increase in referrals to mental health services, but numbers actually getting help up only by 4%. And when I talk to people on the front line in the NHS of providing mental health support, they all tell me they feel overwhelmed.
So there's a 22% increase in referrals to CAMHS for children and young people compared this year to November to the previous November. So I'm not sure where the 35% figures come from, but what we have done is in September we put an 8 million return to school programme, wellbeing return to school programme in schools for children. We've established 24-hour crisis helplines across the UK. But one thing I will say, particularly about children and young people, is they're almost dictating now how they want their services delivered. So COVID in its own way has acted as a catalyst. Before, young people would have to go to somewhere, to a clinic, a hospital, or somewhere to receive mental health one-to-one services. They're now demanding that they have that over the phone, on their laptop, in their home. And so we've now allocated £500 million to the NHS for further mental health services to this year.
But are you saying provision is enough? Because, as I say, when I talk to people in the health service, they feel, as I say, just overwhelmed by the burden of dealing with just too many cases.
Well, I speak to the clinical lead and people in NHS England all the time, and I don't get that feedback. I get the feedback that, yes, with young women aged 15 to 26, we have a pressure point with people with pre-existing mental health illness, but we've allocated £500 million to help to put in place additional services. You know, Robert, throughout the pandemic, there was no closing of any mental health services across the UK.
Which is
not only did those mental health services not close, we put in place additional services. We have increased the number of mental health task force that are going into school. And we're training more people up now. And these are graduates coming out of university.
Absolutely.
That have been through
we haven't got a lot of time, and I do have, you've said quite a lot of this, and there's more that I need to talk to you about. Mental health isn't just about much of what we've talked about. It is also about conditions like alcoholism. I don't know if you're aware, but there were statistics out showing that death from alcohol rose 16.4% in the 9 months to September. And then there were those shocking statistics about the number of young people who were either killed or seriously injured during the 6 months to September, up by a quarter. Now, you know, these sorts of statistics point to really extreme cases of mental health issues.
Well, as I say, Robert, I haven't had that feedback from NHS England, and my responsibility is that ensuring that the policy is put in place to provide the services that we need to meet any rise in mental health conditions amongst young people and adults. I haven't had that feedback. As I say today, I heard that there was a 22% increase in November's figures from last year in terms of referrals to CAMHS. We've had huge pressure, almost crisis point pressure, on eating disorder beds, and that is the most deadly of all mental health illnesses, a mortality rate of 1 in 4. So we see a problem in that area, which we have focused on. We put community eating disorder teams in place to go into homes and deal with that problem with young women, particularly. So that's what we've been focusing on, the information that we have, the data and the actual real time and referrals that we have for services where people need the services, and the funding, which £2.3 billion into mental health funding, never been seen before, £2.3 billion to provide.
I think we can all agree that over a succession of different governments, nowhere near enough went into providing mental health. So I think we can all agree about that. I've just got one very final quick one, and I think this should be very quick. There are lots of concerns that long COVID is leading to particularly depression and other mental health problems. Are you doing any work in this area?
Yes, there is. There's some quite extensive research being done into long COVID, and services are being set up in regions across the UK to deal with long COVID. Is yet to be quantified what it actually means and how it presents. It appears to be very different in many people, but those services have been set up by NHS England across the regions. And, with COVID, we need time to gather the data and to do the research and to get the information.
Thanks so much. Lovely to see you. You've always been a great friend to the show. Hope to see you again